What other big factors do patients need to address when trying to get pregnant?
So we know that if you maintain a healthy BMI, and by healthy BMI, we're looking at somewhere between 20 and 25, but there's good evidence that shows that if your BMI is above 30, then you are more likely to have a complicated pregnancy. We know the risk of miscarriage increases, the risk of developing diabetes in pregnancy, the risk of having high blood pressure in pregnancy goes up if you are overweight. From a fertility point of view as well, if you need to have IVF when you are overweight, then it can be more challenging for us as well. And the NHS criteria to be eligible for NHS funded IVF or assisted conception is that you need to have a BMI less than 30. So the cutoff is there because they want you to have a healthier pregnancy when you do get pregnant. So I would encourage patients to adopt healthy lifestyle, having a healthy balanced diet, making sure they can exercise regularly or go for walks regularly, because the more you look after you, the more likely you're likely to have a healthy pregnancy as well.
And that's important that if they struggle with those measures at home and they can't get the help that they need, that they do reach out to their GP surgery so they can get assisted support on how to lose weight. And that could be things like getting education around how to make their meals, what kind of food choices they need to make, how they can exercise and how they can incorporate into their lifestyle, ultimately to achieve that a healthy environment so that they can have their baby. What about patients who have chronic disease illnesses like diabetes and other associated illnesses? What can they do to improve their chances of getting pregnant?
So I think it's really important that if you have a medical condition such as diabetes or you're on anti-epileptic medication, you're concerned about whether these are safe when you're trying to get pregnant, it's really important then you go and see your doctor or your gynecologist and have that discussion with them so they can tell you whether the medications that you're using are safe to be continued when you're trying to get pregnant, and also to optimize your health. So for example, if you are diabetic, is your sugar control as tight as it could be in order to support you to have a healthier pregnancy? If you're worried about your fertility, I'll be happy to see you, and you can book in using the link in my bio.